Drinking alcoholic beverages is a very normal and accepted part of our everyday lives. It's one of the ways many of us relax from the stresses of a busy life. Alcohol helps us feel less inhibited, better able to enjoy ourselves. But it can also be harmful. We all know that if we drink too much in too short a time, we become drunk, intoxicated, out of control, sometimes with fatal results. Yet there is another form of alcohol abuse that is less obvious, but much more common in our society. It is defined by a level of drinking that most people consider harmless, but which can, in fact, have serious medical consequences. What happens to the alcohol in your drink? Like food, alcohol travels down the esophagus into the stomach to be digested. However, since the alcohol molecule is quite small, 20% of the alcohol in your drink is absorbed through the walls of the stomach directly into the bloodstream. After being partly digested and mixed with the contents of the stomach, your drink is released into the small intestine, where the remaining 80% of the alcohol is quickly absorbed into the bloodstream. Once in the blood, the alcohol is quickly carried into the tissues and organs throughout your body. Because the body recognizes alcohol as a potentially harmful drug, it immediately begins to get rid of it. 85% is detoxified by chemical processes in the liver, while the remaining 15% is burned up by other body organs. Your body gets rid of alcohol at a fairly constant rate. It takes an average 150-pound person 2 hours to eliminate the alcohol in one drink from the system. When you drink alcohol faster than the body can get rid of it, the alcohol concentration in your blood increases. How rapidly this happens depends on several variables. Eating food before or while drinking dilutes the alcohol in the stomach and slows down how fast it is absorbed. Drinking on an empty stomach will greatly increase the speed at which alcohol enters the bloodstream. In addition, the size of a person's body is an important factor. Because muscle tissues are 70% water, a larger person will have a greater volume of body water in which the alcohol can be diluted before the effect is felt. Just what are the effects of alcohol on the body after it is absorbed into the bloodstream? First, some people might feel slightly warm, perhaps become flushed. The alcohol is causing the small blood vessels in the skin to widen, increasing the flow of blood to the surface. While alcohol may seem at first to be a stimulant, it's just the opposite. Classified as a depressant drug, it slows down and dampens those areas of the brain that normally exert control over our actions. With a drink or two, some people say and do things they wouldn't normally do. As one continues to drink, and as the alcohol concentration in the blood increases, more function areas of the brain are depressed. Coordination becomes more difficult. The ability to concentrate lessens.
Hi. How you doing? I look good, you?
It's a great party.
It is good, good.
The drinker's speech may slur. Emotional behavior may be exaggerated. This is the stage at which the drinker is often unaware of losing control.
You're cool. You're cool. So, talking about you're cool. Jill, don't.
Coffee time.
Eventually, the drinker passes out. While this is bad enough, it could be even more serious. If the blood alcohol concentration were to exceed 0.5%, without medical attention, death by heart or respiratory failure would be inevitable. What we have described is how the body reacts to a single episode of acute alcohol intoxication.
Can I have some more coffee, please?
After the drinking has stopped, the liver continues to reduce the level of alcohol in the blood. Slowly, our responses and body functions return to normal, and we sober up. But is that all?
Thank you.
Are there any long-term medical effects from drinking alcohol? Medical research has determined that there seems to be an alcohol consumption limit depending on body size. For the average 150-pound man, his limit is not more than 3 drinks in any 24-hour period. For a 110-pound woman, it is 2 drinks. 1 drink is equal to 12 ounces of beer, or 6 ounces of wine, or 1.5 ounces of distilled spirits. Alcohol consumption below this level is not health-threatening, and in fact, statistics indicate that moderate drinkers may have fewer coronary problems than non-drinkers. However, if one regularly exceeds this moderate drinking level, the body's chemistry and functioning begin to change in health-damaging ways. Millions of people in our society drink more than this, and many have developed a dependency on alcohol without realizing it. Their daily lifestyle includes many occasions to drink: cocktails before meals, wine during meals, after-dinner drinks, and during social events. As long as the body continues to receive its daily supply of alcohol, drinkers are often unaware of their physical dependence on it, unless they suddenly stop drinking and become sick. This is known as alcohol withdrawal syndrome. Mild cases can cause nausea, irritability, shaking, sweating, and insomnia. With the resumption of drinking, the symptoms disappear. The person may never realize that alcohol dependence was the cause of their discomfort. But while the person may not be aware of the problem, the body's organs and tissues may suffer from regularly drinking more than the established consumption level. One of the first organs to suffer is the liver. Because of its role in detoxifying alcohol, the liver is the focal point of damage from long-term drinking. The damage occurs in 3 stages: fatty liver, hepatitis, and finally, cirrhosis. Fatty liver is caused by alcohol-induced changes in the way the liver handles fats. While this stage is reversible, with continued excessive drinking, it can lead to alcoholic hepatitis, where the liver becomes enlarged and inflamed. With hepatitis, cell death occurs, which eventually leads to jaundice, the inability of the liver to adequately filter out waste in the body. With cirrhosis, the remaining healthy liver cells are replaced by scar tissue, which causes internal bleeding, severe fluid retention, and death. All along the digestive tract, there can be numerous direct and indirect injuries from long-term drinking. One of these is that the lining of the esophagus may be torn from vomiting. Alcohol can aggravate stomach ulcers and cause painful inflammation in the pancreas, leading to reduced absorption of certain nutrients in the small intestine. Because the body can no longer properly metabolize its food, nutritional deficiencies occur, which in turn bring on many other health disturbances. A deficiency of one vitamin, thiamine, can cause serious central nervous system damage, resulting in mental confusion, difficulty in walking, and controlling eye movement. Long-term alcohol abuse often leads to other disorders to the central nervous system that include memory loss, poor coordination, and difficulty with conceptual thinking. Because alcohol is a potent, toxic drug, when used in combination with other drugs, the results can be unexpected and dangerous. For example, the beneficial effect of a necessary prescription can be canceled out by alcohol in the system. When antihistamines are taken with alcohol, the level of sedation is intensified. Mixing alcohol with sleeping pills can be a lethal combination. leading to severe depression of the central nervous system and the possibility of death by respiratory failure.
Mr. Healy, the results of your physical examination were entirely normal except for one thing. Your liver is slightly enlarged, and also in looking at your routine laboratory tests, there may be some inflammation of your liver as well. Now, we talked some yesterday about how much you drink, and I'd like to just go into a little more detail.
As we have seen, drinking more than your daily consumption limit for an extended period of time can be the root cause of some poor health complaints and conditions. That's why it's important that during your regular medical checkups, you are candid with your doctor about your drinking habits. Mankind has been drinking alcohol in various forms for thousands of years, and will continue to do so. But as more and more is learned about how damaging excessive drinking is to our health, it makes sense to stop and question our alcohol consumption. Used in moderation, alcohol is not damaging to the body. However, we should never forget that it is a strong drug, capable of seriously altering our behavior and physical well-being.